Health Workforce Australia, who are we and what do we do? I understand you heard this morning from Robert Fitzgerald about the genesis of our organisation through a Productivity Commission report in 2005. So I'll continue the story from where I imagine he would have left off. So Health Workforce Australia is a very new organisation. I'm one of the longest serving members and I've just passed my 12-month anniversary. Mark, for the first 12 months, was really personifying Health Workforce Australia. He and his EA were the organisation for a very long time, and he came to many, many venues like this to explain who we are and what we do. So now he's got a little bit of backup. I'll tell you about that in a minute. We, as I say, had our genesis in the 2005 Productivity Commission report, which then found its way into a national partnership agreement in 2008. The NPA really is acknowledging that in order to make progress in the health workforce, that large-scale national reform is really what's going to be required. And the NPA provides both a funding base and an organisation in Health Workforce Australia to try and carry that forward. There's a specific recognition in the NPA that what is required is a linkage between the health and the education sectors. And there, as you can see, is reasonably significant funding over a 4-year period for some fairly specific things that I'll talk about in a moment. So, as I say, we're quite new. We are a Commonwealth statutory authority. Our Board of Management has representation from all of the states and territories in the Commonwealth, as well as a number of independent members. And we report directly to the Australian Health Ministers Conference. We're headquartered in Adelaide for reasons which remain mysterious. We've picked up some work from our predecessor organisation, which was the National Health Workforce Task Force, which set a number of things going. And we've been continuing them. So in terms of our core functions, we're really focused on 5 areas. Research and workforce planning, which is my own area of Health Workforce Australia, clinical education and training, the innovation and reform program, and international recruitment. And we provide advice through to RMAC and to the community more generally. So we do have a public reporting function as part of what we do. Planning and research. The big piece of work we're doing there is what's called the National Training Plan for Doctors, Nurses and Midwives. It is a large-scale piece of health workforce planning where what we're trying to do is to establish how many of each of those professions we think we're going to need by 2025. And then try and work through quite detailed year-by-year training requirements in order to be able to achieve those targets. It's an ambitious piece of work, and we're most of the way through. We have to report to health ministers at the beginning of December, at which point I'm hoping that many of you will be able to see the results of that work. In conjunction with that, we're establishing a number of facilities which we're making available to our partners in state and territory health departments. In particular, we've been developing some simulation models for health workforce that we're making available, and we're developing a database around the health workforce which will be containing quite detailed information about working hours, areas in which health professionals are specialising, length of time in the workforce, qualifications and so on. And that's going to be, I think, over a period of time, particularly with the introduction of AHPRA and the national registration, a really significant resource for us to be able to plan health workforce in the future. Our innovation and reform program has a $70 million work program in front of it. We have a number of foundation pieces of work that we've been doing in the first 12 months, the most significant of which is the strategy, which you see down the bottom there, the National Workforce Innovation and Reform Strategy. That piece of work has just been released, and it provides a framework for a lot of the innovation and reform work that we're going to be doing in HWA over the next few years. It's on our website. I commend it to you. I guess a little bit more specifically, we've got a number of projects that we're involved in at the moment that are looking at particular areas of the health workforce. So we're looking at the aged care workforce and in quite a bit of detail. We're looking at, or we will be looking at, the mental health workforce. We've just completed a detailed study of Aboriginal and Torres Strait Islander health workers and the impact of national registration on that workforce. So quite a significant piece of work. And we've got a number of projects just starting up, particularly around rural and regional services and cancer services, which I'm hopeful will have quite a significant impact as well. Third area of the organisation is clinical training reform, and that is a part of the organisation that's mainly been involved to date in administering a program which provides funding directly to clinical training providers. So that's hospitals, community health centres, GP clinics, other places that provide training and supervision to undergraduate students or entry-level students into the health professions. So when we were first established, one of the issues that was we were really put in place to do something about was to try and increase the number of health professionals in Australia. So our first piece of work was to try and identify, well, who are the missing health professionals, who do we need more of, and then tried to look at what are the main barriers to being able to have more of those health professionals. One of the main barriers that's been identified is the availability of clinical training in health settings. So the funding that Health Workforce Australia has been providing has been to try and increase the range of clinical supervision, particularly in rural and regional areas, and particularly in the private sector. So that funding is really to try and increase the number of students that the education and the health systems are able to accommodate. We're also looking at a clinical supervision program, and that's really trying to address the fact that clinical supervision is quite patchy. There are not particular standards about what students are expected to learn when they do a clinical placement. There's not information or resources available for supervisors to help them in the task of supervision, and so we're doing some work there to try and assist with that. Simulated learning environments is providing funding to try and promote the use of simulated learning, and again that's directed to a similar kind of thing. If you can increase the use of simulated learning, then you increase the capacity of the education system to be able to produce more students. And the last one there, integrated regional clinical training networks, is established to try and bring together education providers, training providers and health system professionals at a regional basis to try and better coordinate clinical training. Just on a couple of specific areas, we're looking at developing the National Competency Framework for Clinical Supervision, so that really underpins the work I was just talking about. That's trying to provide resources, assessment methods for clinical supervision so that there's a greater uniformity in what's achieved in clinical supervision. One of the outcomes of the National Mental Health strategy that was approved by ministers recently is a piece of work that we'll be undertaking on developing mental health workforce competency framework. And the clinical supervision support program, again, just to describe that a little bit more, is really, as I say, trying to provide those supports. They are, I think, all of my slides. So there you go, nice and quick. I can take questions.
Mary Chan from Aged and Community Services Australia. it's great to see all the work that Health Workforce Australia is doing, particularly around workforce planning and the needs or requirements of the future for nurses and medical doctors. But we're very concerned, obviously, about the next level down, the carers. There is a big shortage, and the population of carers is ageing, of course. Are you looking into the future of perhaps, stepping down the next layer?
Well, in fact, we're looking at the carers workforce as part of the National Training Plan this time. But the intention with the training plan is that we'll be doing it every year, and we will be expanding the range of professions from next year. And we'll be looking in particular at those professions that can substitute for or provide support to the ones that we looked at this year. So assistance in nursing is high on the list of professions that we would be wanting to look at in that second round. The other thing that we will be wanting to do from next year, the training plan that we've done so far is really profession-based. What we'll need to do is start to do sector-based planning. So we need to consider aged care services as a whole, and what's the workforce that's required to deliver that set of services, and that goes well beyond the kind of very narrow profession-based planning that we've been doing today. Much more challenging, but I think that's where we need to start heading.
Hello, Linda Boland from the New South Wales Department of Education and Communities. I'd like you to address the issue of how you see school-based traineeships and other forms of work experience in that sector, and whether that's an integral part of your planning.
Okay. I would say that to date we haven't given that as much thought as we have to vet and university training. We, I think though,
sorry,
yes, school. Yes, I understood you were talking about vet in schools, but where we're focusing our attention at the moment has been on particular professions, and the ones that we have been looking at in this first round have been mainly focused in the university sector. So as we move further into some of the other professions, I imagine we will start to look much more detailed at the provision of training in vet in schools as well as other RTOs.
Actually, it's interesting because I think that's one of the challenges as we go forward is, and one of the places that I think the Community Services and Health Industry Skills Council is ideally situated to step in and work in partnership with Health Workforce Australia, because it is actually ideally situated to be one of those linkages between the vet sector and what is essentially the higher education sector, and there does need to be some connectivity there. Part of the problem is that our different departments are actually funding different elements of the education continuum, which I think is an ongoing issue. But we'll put Rod into that gap and see how you go on next year. You can update us on that one. I'd like you all to thank Ian for his presentation. Thank you. We look forward to working with you.